guys, this is Shamima from Doctor to Help. This channel was started to give free medical education to anybody who is interested to learn simple medicine and practice it in their life. Today we are going to talk about depression. For those who don't know me, I am Dr. Sattar. I'm an internal medicine doctor, board certified, practicing in Texas. And today we are going to talk about depression management without any medication. And before I start, I want to let you know I'm dedicating this video to all my friends and my teachers who has always been there for me. In my childhood, I also suffered from severe depression. So everything I tell you, I see it from my heart. Remember that if I can come so far, so can you, and you can go further. All right? So without further ado, let's talk about management without medication. The first thing I want to talk about is exercise. I want everyone to know if you exercise more than 35 minutes a day, about moderate to strenuous exercise is good. It will release happy hormones, endorphins that elevate your mood. So it is very important. There was a study that was done in Norway that showed even if you do 1 to 2 hours of weekly exercise in increments of 10 to 15 minutes, it still elevates the mood. So do not throw away whatever you can do. Just do it. Find a partner. Try to go biking together, swimming together, running together, and that will increase your adherence. If you can't go with your partner, that's good. All right, well, whoever works, just go with someone. If nobody is there, go alone. It doesn't matter. The open environment is very healthy for you to go for a run. If nothing else, get a Peloton and do it at home. Next, I want to talk about food. You want to eat healthy food. Decrease frozen, carbonated sodas and caffeine. Decrease sugar. Caffeine actually reduces the good hormones that are there to help with depression. So you want to reduce caffeine. You want to reduce sugar in your life. Third, please eat healthy food. What kind of food? I would like you to eat sardines, salmon, mackerel, those kind of food, coconut oil. Also, I wanted to mention that supplements are very good for brain health as well. Vitamin B12, folate, vitamin C, and D. You can search more on those, how they help, but those are very good not only for brain development, nerve development, and making good connections in your brain. So this is very important for management of depression. When you check levels on depression, major depression patients, usually you see that those levels are low. Also, another reason I want to also point out iron supplement. That's also something else that you want to keep an eye on. You want to make sure you're not low in iron. I also suggest to my patients always to check thyroid disorder. If you're hypothyroid, you can have similar symptoms as depression, so you want to rule out that cause as well. So next I want to talk about decreasing stress. How can you decrease stress? There's so many ways. What is giving you the stress? Take a hard look at yourself. What is the stress triggers in your life? Is it your job? Is it your boss? Is it your marital status? Your friendship? Think about it. Is it bullies at school? All of those, you want to think hard and you want to avoid those risk factors. If you cannot avoid them, think about how you can accept and do the best of each situation. If you're in a bad marital situation, do everything you can to make it better. If it doesn't work, maybe it's time to walk away. You don't want to be in a toxic relationship where you cannot grow and you cannot be happy. Next, I want to talk to you about sleep hygiene. What is sleep hygiene? Everybody should have 7 to 8 hours of sleep. Every adult needs 7 to 8 hours of sleep every night. You want to go to bed at the same time and wake up at the same time every day. What it does, it gets your body to acclimatize with the routine. So when you go to bed, your body knows that it's time to relax and fall asleep. So remember, the bed is for sleep and sex only. Don't read, don't turn on the TV, don't really listen to music unless it's calming music that helps you to sleep. You don't want any distractions. You want to calm down and fall asleep. I also would recommend don't eat any heavy meals 3 hours before you go to bed. You don't want your metabolism running even when you try to sleep. You don't want that. You just want your body to relax and fall asleep. So remember all those things, and you can search under sleep hygiene and get even more information on it. One other thing, people who have sleep apnea has is highly correlated with depression as well because they have poor sleep. Sleep is the time when our brain and our body repairs and regenerates. All our long term memory gets incorporated in our brain when we sleep. So, sleep is very important. If you are not sleeping enough, your body is off balance and nothing works. Everything makes you stressed and your mood goes astray. So, yes, it is very important to relieve stress. Next, I want to talk about negativity. If there's people who are always talking down to you, talking negative things about you, maybe you want to avoid them. You want to surround yourself with people who are very positive and have positive influence in you. They're encouraging you. They're saying all the good things about you, reinforcing your good feeling and decreasing your low self-esteem. When we are depressed, we hear all the bad things and they become harder, 100 times harder. We are our own worst critic. Think about that. We are always saying, oh, I'm not good enough. This feeling just brings the person who's depressed down every day. I want you to come out of it. I want you to give yourself a break. It's called a stress break. Think about it. If the same thing that you are being harsh to you about yourself, what if a third person did it? Would you be so much of a critic to them? So step out of that shoe. See yourself as a third person and learn to forgive. If you don't forgive and love yourself, it's going to be hard for anyone else to love and respect you. You have to learn and respect yourself, and you also have to forgive whatever you did that you cannot forgive yourself. You have to accept. And anybody who has given you a bad turn and made your life miserable, you have to also learn to forgive them. It is part of your healing. Also, prayers. Prayers is very good to relieve stress. When you pray and when you have faith, you know there's somebody to fall back on. You know He's there to help you. So think about this world as a place where you're being tested. And what Lord had said, if you take one step, I will take you the next 3 steps. You just have to take the first one. And He will help you the rest of the way. Believe in your faith. It doesn't matter what kind of faith you have, with which religion you have. You just want to have good faith. All faith, all religion teaches us to be a better person to our next person, whether they're our family, our friends, or a stranger, or a neighbor. Which comes to the last point that I want to talk to you before I almost finish, is do some service to the community. That will really make you feel good. You can help your neighbor. You can give somebody rides if they need ride. They need groceries in this COVID-19. Your elderly person who is your neighbor, you can do that. You can even serve at a homeless shelter. A lot of people, elderly people, volunteer at the hospital. All these gives you a good feeling. If you don't know of any options at your hand, you can also go to justserve.org and they will give you more opportunities that you can choose from. Lastly, I want to talk to you about cognitive therapy. This is provided by a psychologist or a social worker. Please do not throw that option away. I know a lot of my patients tell me it's too expensive for them to go to a psychiatrist, but you can see a psychologist or a social counselor and they can help you. How do they help you? They listen to your story. They hear all the negativity in your life, the stress in your life, and they know how to manage them and help you to guide them in a way that is acceptable for you, and you are able to think it in a positive way. So they will help you in many ways that you cannot even imagine. So please do that. Study shows medication and cognitive therapy together is better in the management of depression other than only medication alone. If none of these options help you, or you have a more severe depression than mild to moderate, then absolutely you need to talk to your doctor and get on medication. As far as medication, please remember it takes 4 to 8 weeks for antidepressants to work. So don't give up. If you started a medication and you feel like after 2 weeks it's not working, or you're having side effects like decreased sexual function, you're having stomach upset, nausea, vomiting, dizziness, anxiety, all those things usually gets better. So that's why we try to start you on a low dose, and in 2 to 4 weeks we try to increase the dose and go on. But it can take up to 8 weeks to see a good improvement. How would you know if you're having improvement? You're having a better sleep cycle, you're not having interrupted sleep, better sleep, your mood is better, you're having more energy to do your regular work. All those things are sign of improvement. So think about all these things when you are treating depression. Please talk to your doctor. Do not stop any medication. And if you are having any thoughts of harming yourself, please call the suicide hotline. I'm going to put the link here for you. You can click on it. You can also Google search at any time and it will show you, and you can call them. And if you can't reach anyone else, guess what? I'm here for you. Yes, I will stop whatever I'm doing to talk to you, and you know how you can reach me. Just search me on Facebook, send me a message, I will call you. I will make time and I'll be there for you until you can get more help. So no, I am not ready to lose another friend to depression. Neither are you. So let's work together and make this world a better place. And before I go, Happy New Year. Again, this video was for my friends and my teachers who has always been there for me, and my dear nurses and colleagues who are directly and indirectly taking care of all those COVID-19 patients. I cannot imagine what you're going through. So thank you. I salute you for all your service. Please be happy. Let's be happy together. I am here for you. Until we meet again, you take care and Happy New Year. Alexa, play It's Raining Tacos.
Raining Tacos by Perry Grip on Amazon Music.
It's raining tacos from out of the sky. Tacos, no need to ask why. Just open your mouth and close your eyes. It's raining tacos. It's raining tacos out in the street. Tacos, all you can eat. Lettuce and shells, cheese and meat. It's raining tacos. Yum, 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 yummity yum. It's like a dream. Yum, 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 yummity